Hi, my name is Sabrina Swayzer. I'm a student nurse at Nightingale College. Today I'm going to be reporting my vital signs skills video. I am in my full Nightingale uniform as well as my badge. Before we get started, my model today is going to be Michaela. Michaela, do you consent to being filmed and recorded today?
Yes.
Great. I'm going to gather up my materials, which is going to be my stethoscope, my analog watch, and my manual blood pressure cuff. I'm going to respect my patient's privacy by knocking on the door and being allowed in. Knock, knock.
Come in.
I'm gonna go ahead and close that door behind me and perform hand hygiene. Hi, Michaela. My name is Sabrina. I'm going to be your nurse today, and I'm going to be assessing your vital signs. Before we get started, would you mind telling me your first name, last name, and your birth date?
Michaela Burgess, July 7th, 1993.
Great. So today I'm going to be taking your pulse rate, your respiration rate, and your blood pressure. We're going to get started with your pulse rate, so I'm just going to go ahead and have you relax here. I'm going to use these two fingers here and go ahead and find your radial pulse. All right, found that, and it does seem to have a steady normal rate and rhythm. So I am going to count here for 30 seconds. All right, in that 30 seconds, I did count 41 beats. So because your rate was steady and normal, I'm going to multiply that by 2, and we're going to get 82 beats per minute, which is within the normal ranges of 60 to 100 for someone of your age range. I am going to go ahead and just take that reading one more time just to be sure. So I'm just going to ask you to relax one more time. All right, and I am going to go ahead and start counting here for another 30 seconds. All right, in that 30 seconds, I was actually counting your respiration. We don't like to let patients know that because we don't want them to alter the way that they're breathing. Your breath depth was normal, so I did count 8 breaths in that 30 seconds. So I'm going to multiply that by 2, and we're going to have 16 breaths per minute, which is within the normal range of 12 to 20 breaths per minute. Now I'm going to go ahead and move on to taking your blood pressure. I'm just going to have you go ahead and extend your arm here so I can find your brachial artery. All right, I have a nice steady pulse there, so I'm just go ahead and have you relax here. I'm gonna put on my blood pressure cuff here, and I am going to line up the markings with your brachial artery. I'm gonna place that about 1 inch above where I found that at. While I'm putting this blood pressure cuff on, Michaela, would you happen to know your normal blood pressure?
120/80.
Great. We're going to make sure this is nice and snug. I'm going to pull your shirt so we don't get any interference. I'm going to ask you to hold the meter for me. Because you told me your normal blood pressure is 120/80, when I'm pumping up the blood pressure cuff, I'm going to go 30 above what your normal reading is. 250 systolic. There we go. To start your blood pressure reading. I'm going to go ahead and put on my stethoscope. I'm going to tap, make sure that it's on. Warm it up a little bit so it's not so cold on your skin. And I'm going to go ahead and place my stethoscope diaphragm on your brachial artery, making sure not to touch the cuff or cross any tubing to get any interference. I'm going to go ahead and pump up to 150. Now that I'm at 150, I'm going to slowly let it out. 2 to 3 per second. All right, Michaela, for your blood pressure, I did get a reading of 100 at the first Korsakoff sound, which is going to be your systolic, and on the last one, it was around 64 for your diastolic. So that reading is going to be 100 over 64. That is within the normal range. Your diastolic is at the lower end, but overall, you're still within the normal limit for someone of your age. I am going to gather my materials. Perform hand hygiene and go document. Thank you.